Hey, Margie here. Do you ever forget somebody's name or run upstairs and you forgot why you went there? Or don't remember where you put your keys and start worrying, oh my gosh, I'm getting Alzheimer's or I'm starting to have changes in my brain? Well, the good news is there's so much that can be done to both prevent Alzheimer's as well as reverse it. And this is such an important topic because you can have fantastic bones, but if you're starting to lose your mind, you're not going to be able to enjoy your life. And so today, that's the topic we're going to talk about with our very special guest, Dr. Josh Helman. And Dr. Josh has a medical degree from both Harvard and MIT. He has 2 degrees in biochemistry, and he applies this to his holistic approach to patient care. He's co-hosting an upcoming summit called The Truth About Alzheimer's and has a lot of experience in both preventing and reversing Alzheimer's. And today's interview, we go over some of the root causes of Alzheimer's, and Dr. Josh shares his best tips that we can all put into our life right away for optimal health of our brains. So stay tuned. Welcome, Dr. Josh, to the podcast. I'm so glad to have you here.
Awesome. It's really a pleasure to be here. Thanks, Margie.
You know, this topic is so important, and it's something that really means a lot to me because I've seen young people with the beginnings of Alzheimer's and then how it progresses. And, my community deals a lot with osteoporosis and bone health, but you can have the best bones in the world. But if you don't have the cognitive, if you're starting to lose your mind and getting it, it's just so sad. And I think the saddest part to me is that people don't know that there's a lot that can be done. So that's why in the podcast, I'm so excited to have you. And I've had some people already discuss this, but everybody brings their own angle. And the more people can learn at any age, the more we can prevent this. And people don't have to suffer because there is hope and it's just not out there, this information. So I'm so glad you're going to enlighten us. So why don't, from your perspective, because you have, before we even go into
Okay.
Alzheimer's, and why don't you just tell us your story, how you got involved in this work and how you sort of got into integrative medicine and taking a different approach than than your conventional training. So why don't you share that a little with us?
Sure. Where to start? So basically, when it comes to Alzheimer's, I had a grandmother who had Alzheimer's. So as a kid, I saw it firsthand how devastating it can be for the person and the family. But my own background, I ended up deciding to go into medicine. I got 2 degrees from Harvard, including 2 degrees in biochemistry. So I was one of these science nerds, but I didn't like spending all my time in the lab. I actually liked interacting with people. So that's how I ended up deciding to go into medicine. And it's kind of interesting, how did I end up? Because my first training was in emergency medicine. I got board certified in emergency medicine, and then transitioned about a dozen years ago into integrative medicine because it was basically for selfish reasons. I was 50 pounds overweight and had high blood pressure. And, being this Harvard trained physician, I couldn't figure out how to fix my own problems. And it was ludicrous. And it was at that point, I went back to my 2 degrees in biochemistry and, the core training. And I fixed my own problem, and then I wanted to help other people. And it was kind of fortuitous. About 6 or 7 years ago, a friend of a friend said that, that they were looking for a physician to help out in this Alzheimer's dementia type clinic that was also seeing Lyme and mold type patients. And, I was really skeptical at first, and I went there, but I was so amazed because they were actually using basic biochemistry. They were looking at biochemical markers in both the urine and blood and other things. And the admiration, I think, was mutual because they had interviewed lots of physicians to try to, take a position there. And none of those physicians actually understood the biochemistry and the different amino acids and things like that. And, it was a click. But I will say it was devastating. It's very challenging working with a patient who doesn't remember day to day. You can have a 30-minute conversation with someone, and then the very next day they're going to ask you the exact same questions all over again. So it's definitely a challenging field. But the exciting reason that we're talking today is the good news is that Alzheimer's disease is preventable and reversible.
It's so exciting. And the message just isn't out there because people look at me like, oh yes, come on, and they don't realize, I think maybe one of the problems is that it's not like there's one cause. So some of the research has been multifactorial, where there's many different things. And I don't know. And maybe because all the medications have not been effective, why this isn't out there. But I'm glad that you are having a summit. You're sharing this. It's so great. So let's talk about then what you found are some of the causes of Alzheimer's that we can actually make a difference with.
Yeah, and let me be clear that for different people with Alzheimer's, there are different causes, and there are different priorities. So with one person, there might be, 10 different causes, and then with another person, there might be the same 10 causes, but with different percentages of importance. And it's interesting looking at the data. One of the things that falls out as one of the most important things leading to Alzheimer's is actually not getting adequate sleep. I mean, that was a real surprise because, I mean, thinking back to my medical training 30 years ago, it was a sign of, macho or strength that, I didn't get any sleep. I was working with patients all last night, and then I'm functioning the next day. That was encouraged, and that was, a sign of being a good physician. And now what we're learning is that's the exact opposite. If you want a healthy brain, you need to get adequate sleep.
You want to expand upon that a little? What are some of the causes that you've seen that people aren't? So many people have issues with sleep and they wake up in the middle of the night, and there's many different reasons for that. What have you seen, though, are some of the causes that you were able to make a big difference with?
Oh, sure. So one of the common causes is medications. There are prescription medications that fall out as making it difficult to sleep. And, but I mean, literally we could talk hours about different people have different issues. The, um, the basis I found often for difficulty sleeping was poor neurotransmitter levels. So if people's serotonin level was too low, they would have trouble sleeping. If their melatonin level was too low, they would have trouble sleeping, things like that.
And so then did you have them tested, or did you just from symptoms figure out serotonin, whatever was low, and then give them the appropriate amino acids? Is that how you treated that?
Yeah, so we would look at everything, but including neurotransmitter levels. And if their serotonin level was too low, we would end up giving 5-HTP or a similar supplement to try to raise their serotonin level. It was more complicated than that, but that's just a simple example.
I love that, though, because a lot of people don't even realize about amino acids, and that you can tell right away. It doesn't take months to figure out if this is helping or not. So that's so interesting. Okay, so sleep, we have to prioritize. And I agree with you. People would brag, oh, I only got so many hours, like, ha ha. Well, ha ha, you're destroying every aspect, and your bones, your brain, everything. So it's so, so important.
Yeah,
Is there any tip you could give this audience, like any one thing you would say in terms of sleep? I know there's many different things, but anything that everybody could benefit from that you've
sure.
discovered?
Yeah, I'll pick one, which is using temperature as kind of a biohack in order to get to sleep. It turns out that our bodies are designed to go to sleep when our temperature goes down. So we can create that situation by turning down the temperature in the room we're sleeping in right before we want to go to sleep. And the reverse is true. When the body's core temperature rises right as we're trying to wake up.
That's so interesting. An easy thing, right?
Yeah. An easy thing to try.
An easy thing to try. That's what I love. Easy tweaks that can make a big difference. All right, so let's continue on some other. All right, we talked about sleep. What are some other causes that we can make a difference with?
Yeah. So where to begin? I think one of the keys that I've seen is exercise. Exercise not only helps promote sleep, you know, at night afterwards, but exercise has also been shown to um, improve brain function. And one of the mechanisms is it promotes a hormone called BDNF. But the exciting thing is that exercise is powerful, and and again, that's not something that was emphasized when I was going through my medical training, 30, 40 years ago. It was like, oh yeah, it's a cool thing to do, but it takes time. And no, it's like our bodies are designed to exercise, including our brain.
I mean, you're talking my language on exercise, but I think the research, the BDNF, do you much want to go into that a little bit, what that does, the BDNF? Because I think that's amazing to know your exercise is helping your bones, it's helping every aspect of your body, but also it truly is helping your brain. So just maybe explain about the BDNF a little bit more.
Sure, sure. BDNF stands for brain-derived neurotrophic growth factor, and it actually promotes the growth of new neurons and new neural connections, which is how we form memory and learning happens.
I love that. And I also think it's interesting. So what that tells us is, right, we want to also do novel things. We don't want to just keep doing the same old exercise, like add new interesting things and combinations to even magnify that effect.
Yeah, and I will add, one of the other amazing things about exercise is that we sweat, and you might say, oh, that's gross that we sweat. No, actually, we're designed to sweat, and when we sweat, we release in the sweat certain toxins. And in our so-called modern society, we're exposed to all these fatty toxins like PCBs and DDT, and then some heavy metals, and all those things can definitely contribute to Alzheimer's.
With your experience, have you seen the people you've tested? Have you noticed that there is an increase in toxins? Have you seen that as one of the big contributors?
I have. I think sleep is better, but I think and different people are exposed to different types of chemicals. I mean, I've had patients with Alzheimer's who were working in a gas station, and so they were around large amounts of petroleum and had high levels of benzene and additives like PERC. And the exciting thing is we were able to lower those levels of the petrochemicals using different IVs and binders and things like that. And as we lowered those levels, we saw their brain symptoms, their brain getting better. So,
Wow, I love that. And I also think that the interesting thing is you could have been exposed a long time ago. It doesn't have to be a recent exposure. This can stay, and lead stays in the bones. It stays, some of these chemicals and some of the heavy metals stay there from a long time. So do you recommend people work with their practitioner? What's the best, if people are thinking, oh, that could be me, what's your thought on that in terms of the heavy metals and the toxins?
yeah, I would definitely work with a doctor who's open to looking at these things because, you know, even though sure toxicology is an established medical discipline, but medical students get very little training, and I know I got some training in because in emergency medicine, toxicology is a sub branch of emergency medicine, but most physicians that's not part of their core knowledge, and it's a real deal. And as you mentioned, some of these fatty toxins, petrochemicals, PCBs, DDT, they have half-lives in the body of 10, 20, 30 plus years.
Yeah, so if someone, I'm not sure what, in terms of the typical doctors people see for Alzheimer's, though, is that neurologists or, yeah. So if they went to just their general neurologist, that would not be part of the, unless they're trained by Dale Bredesen, that wouldn't
Right.
be part of their basic workup. Is that true?
That's true. I would look for a functional neurologist. I've got nothing against traditional neurologists, but I find the functional neurologists are actually open to other ideas, and they're open to looking at these issues.
My motto is dig deep and never just settle. When someone says, we haven't had good research on this. We'll do the best we can. There's some medicine, whether it works or not. You dig deep and you find, and that's why I'm having you on the
Oh, thank
podcast.
you.
You find the people who have had good luck and have no other methods and other things that can be done. And I think it's exciting with Dale Bredesen and the new research and Heather Sanderson's research that, when we combine all these factors, we're actually seeing results. That's just been really wonderful.
Right, right. And I think, Big Pharma has proven, they spent billions of dollars on, going after amyloid plaque as the magic problem and solution for Alzheimer's. I think they've proven that that's not going to work, that you need to take a step back and look at all the underlying causes.
It's interesting, right? Because someone finds out they have amyloid plaque, they're like, oh my gosh, it's a dead end for me. Do you want to just explain why amyloid plaque is not the end of the world and what could be causing the amyloid plaque? That so it's actually being protected. It means to be protective, but why don't you
Yeah,
share a little bit about that?
yeah, the exciting news that's come about recently is that amyloid plaque is actually formed by the body, by the body's brain, as a defense, the immune system as a defense against infections in the brain. So it's almost like, if you cut yourself and you form a scab, the scab forms to start to protect your skin and your body from infection. The same thing in the brain. The amyloid is a way that the body tries to heal and fight against biofilm, bacterial, and other types of infections in the brain. So that's why medications that have been developed and have not been successfully released to the public that just get rid of the amyloid plaque, they don't work because you're not getting to the root cause. In this case, you're not getting to the infection.
Yeah, that's so interesting. And I also think your background, which we talked about beforehand, when you were working with Lyme patients and you were working, you saw a lot of people very young having cognitive decline and issues. Do you want to share a little bit about that? Because I think that sheds light on some of the problems.
Yeah, no, it was interesting. The dementia problems with infections like Lyme disease, mold toxicity, Bartonella infections, parasites like Babesia. Some of the sickest patients I saw were actually relatively young, 17, 18, 19 years old. And their families had this, or the patient and their families had this dilemma. It's like, do we let our daughter go back to college and try to do another year of college when her 4-second and 4-day memory wasn't working? I mean, she might have a great year at college, but not remember any of it. What's the purpose of all this? So yeah, so even though, traditionally Alzheimer's, you think of as someone in their, 60s, 70s, 80s, we definitely see many patients, in their teens and in 20s and 30s with dementia. But the exciting thing is with intensive treatment, going after the infections, going after the toxins, in going after, for example, mold toxins, we were able to reverse the dementia and give people their lives back, whether that meant going back to school or being able to go back to their work or, be able to start a new business.
So exciting. You mentioned mold, and unfortunately, with the weather changes and with flooding and with their mold for a lot of people is a huge, huge issue. Is that something you see frequently as one, as a problem for the people you've been working with?
I do in Alzheimer's and other conditions. And it's a complicated field. We could spend hours on it, but just to simplify it, when you're talking about mold, you're talking about two different parts that you need to heal. On the one hand, mold is alive. It's alive. And if you have mold in your brain or other growing in other tissues in your body, you need to actually kill, this live thing. So that's number one. Number two, within mold, you have these fatty toxins called mycotoxins or mold toxins, which are separate from the mold itself. And you need to figure out a way to remove these fatty toxins so that they don't hurt your brain and other tissues anymore.
Yeah, and they'll affect your bones as well.
Exactly.
And okay, so let's continue because we could talk for hours on each one, but I just want to give people, and we'll talk about your summit because you do have experts on each of these fields who will go into these things in more detail, which is so exciting. All right, let's talk about my favorite, and not really my favorite, but something that I feel that I work with people a lot on, and something I've had to work on myself. And I think I see the biggest change, and sleep goes along with this, is stress, because a lot of people sort of poo-poo this and like, oh yeah, everybody's stressed and no big deal. And they become stressed about, oh my gosh, I'm not remembering things, or stressed about my bones. What do I need to do? And not realizing that this stress itself is a very huge component and needs to be dealt with. So what have you seen in terms of stress in your practice?
Yeah. So what I've seen is most of the Alzheimer's patients are under a lot of stress. I mean, they constantly they don't know where they are, necessarily, or they're always second guessing themselves. And what I've seen is by by a lot of these other treatments, we can lower their stress levels. And I think it's really important for the audience that's watching or listening to understand that this isn't just end stage Alzheimer's, that our so-called modern society, I think we have much higher levels of stress all of the time than we're designed to deal with. And a perfect example for that is, watching TV. If you turn on the news, most of the news is scary things that are stressing our system.
Yeah, it's so true. So do you have one tip? Is there something when you're working with people, like, and you find out they're really under stress, is there one thing you can share with people that you found super successful or helpful?
I would give two. I mean, one is
Okay, you can give
obviously,
two.
yeah,
You can give two.
obviously try to unplug from the media, and including social media, as much as you can. And then tip number two would be to try to bring in connection, because I find that people are often stressed by themselves, but if they can talk about it, if they can take deep breaths, focus on meditation or whatever, yoga, whatever form of relaxation they like, that their stress levels come down and that their body's immune system, other systems are able to heal as long as their stress system has come down.
Yeah, I love that with connection because I just couldn't get over the results of that Harvard study where they found out of everything, the most important thing was your relationships in terms of your life and in terms of, so yeah, we sometimes minimize that. So that's so, so important. Thank you. Okay, so let's go. Any other causes that you want to share? I know we could go on and on. Is there any other really important ones that you think need to be said?
Wow. I mean, I think of stress. I also think of what I would say oxidative stress from being around some of these petrochemicals and heavy metals that we talked about earlier. So I think it all adds up.
Yeah, it really does. Okay. And as I said, I'll give everyone the information on the summit because people will go into each one of these. You have talks. I love the talks. You have talks on, in these different areas in detail. Let's talk about the supplements that you found. Are there any certain supplements that you can enlighten us to that have had potential and have really helped people?
Yeah, and again, we could literally talk for
Yeah.
hours about different supplements. I'll just add a few
Yeah.
here
Great.
for people to look at. One would be lion's mane, which is it's a type of mushroom, but we found that for patients who are on lion's mane, and the studies are showing this, it's a lot easier for their brains to reestablish connections. Another good supplement for the brain is actually creatine. And this was a surprise to me because 95% of the creatine is actually in our muscle. And it was originally used by bodybuilders who wanted to build big muscle, but it turns out that creatine, this supplement, is a neurotransmitter. 5% of it's in the brain. So if you take creatine as a supplement, you're going to end up increasing the amount of creatine in your brain, which having more neurotransmitter in this case will actually help with brain function.
Oh, that's great. Is there any people that would be contraindicated, the lion's mane and the creatine?
Yeah, I would say before starting any supplement, make sure you see your doctor. Make sure your liver and kidney are functioning well. You're drinking adequate water. Those things. I don't want people just to go off willy nilly. And with uh, chronic diseases or metabolic
Oh,
problems.
yeah.
But in general, I would definitely look at lion's mane and creatine.
Okay, great. And what about medication? What's going on? Can you like fill us in on where the world's at with medication, and is it something that some of us should look into? What are your thoughts on that?
Are you asking, some of the medications for Alzheimer's or just in general?
No, no, no. Obviously, medication is necessary for things, but in terms of in general, is there anything that you've seen that might be promising, or is there anything, in terms of Alzheimer's?
Yeah. So let me think. So what I've seen in my clinic is um, what was called exosomes, which are formed from stem cells. We've been able to give intravenous exosomes to patients with Alzheimer's and reverse it. Now it does take a few months, but in our hands, I've seen good results with exosomes, which are basically a collection of say 500 different types of peptides that are derived from stem cells. In this case, from umbilical cord blood. I know it sounds gross and kind of complicated, but it's the growth factors that I've seen be able to reestablish and regrow brain cells when we look at PET scans of patients' brain, looking at brain activity.
That is so exciting. So if someone's interested in this, can they go to your clinic, or where, where could they, if they wanted to explore this, who else does this type of thing?
Yeah, so we definitely have some lectures on exosomes and stem cells in our summit, but in terms of finding experts, unfortunately, some of the cutting edge research is being or clinics are in other countries. Uh, I would say stay tuned. We'll definitely be doing some programs on it, but the clinic that I was in Tampa is unfortunately closed right now, so I can't refer people there. But there there are definitely clinics that are using stem cells and exosomes, and the technology is getting better. So, but I'm not going to give you a specific.
Okay, so you're not your clinic. I guess that was my big question.
Yeah,
You just need to figure out who, and in the summit they'll also have people talk about that, which is so great. But you'll let us know. I just was wondering if your clinic is currently doing that. But
yeah,
that
not currently, but stay tuned.
okay, well,
Yeah.
stay tuned. So, is there any? Why don't you tell us about the summit? Why don't you tell us about the summit? Because I just think the speakers you have are so fabulous, and I love summits because it gives you a smorgasbord. There's so many different areas that you can choose. You can pick and choose. You know what? I could have Lyme. I want to watch this, or I could do this. So yeah, why don't you just share a little bit about the scope of the summit?
Yeah, so the summit's amazing. It's free and it's over the course of 7 days. And what I love about it is it covers so many. There are almost approximately 50 lectures. It covers so many different topics. And just as we've covered the surface just now, if you look at Alzheimer's, the causes, you're dealing with dozens of different causes. So of course we have the big names in Alzheimer's research and clinical practice. We've got Dale Bredesen, Dr. Dale Bredesen. We have Heather Sanderson, but then we have some lectures on some topics that relate definitely to Alzheimer's, but they also relate to reversing aging. And I'll give you an example. Someone that's not well known yet. Heidi Crockett is has a. I interviewed her, and she shared with the transformation she's had with cold plunges and cold therapy. So you're going to get lots of um, what traditional things, but this is going to be a real eye opener. I even get to interview you on the
Mm.
summit. So
Yeah, I talk about bone health because as you know, it's as with aging, and some of the things are the same that help your bones that also help your brain. So just things that people can do. That's interesting about the cold plunges because I do the cold showers and the hot, and I do that, and I always say I have a good friend who lives in Canada and really goes in and does the cold plunges, and she said it's changed her life completely. So it's just, but that's free. It's a free thing,
it's it's
you know.
it's it's free
Yeah,
to take a cold
yeah.
shower and
Mm.
regrow neurons and fix chronic pain and other problems. Yeah, it's amazing.
Yeah, that's the fun thing, like, and I know because 'cause I've done 2 summits, I know how much work it is, so it's really a labor of love because it isn't easy, and it's very time consuming, and you're doing it with Dr. Rob Love, who
Yeah.
I'm such a big fan of, and, yeah, so I think it's just so much information, and I think that's the best part when people come to the summit. Everyone will learn something. Something. There'll be something new for every person, but everyone takes something out of it so different. And, and usually it's life-changing. And I think as a summit host, there's just nothing better than knowing you've reached thousands. And I mean, I think 60,000 people came to the last summit, that you've reached all these people and they're all able to take bits and pieces and even figure out what practitioner they may want to work with or something that that they're missing in their life and that it can really enhance it. So I'm so excited. I'm going to come because there's you have fabulous speakers and so many interesting talks. Maybe she'll convince me to actually do the cold plunges because I am a swimmer and I
Right.
love freezing. I love going in the water when it's nice and cold. That's my favorite. The cold plunge is another level.
Right. But the exciting thing is you can just do your hand to start with, and the
Mm,
more you do it, the easier it gets because you actually grow brown fat
mm.
from the cold exposure.
Ah, so exciting. Is there Yeah, so we'll have the link to that in the show notes. Is there anything else before we end? We could go on and on. As we said, this is a summit that's 7 days, but we're just picking up little pieces and giving people little tweaks that they can put in. And I think it's the awareness that there's more possibilities. It's not, and if your doctor says to you, we'll try this medication and I'm just sorry. And, you need to dig deeper. I mean, it's unfortunate. And I love conventional medicine. My whole
Sure.
family are conventional. So I'm not a person, quite honestly, that I just think so much has been done and so many lives are saved. And I really believe it's not that doctor. And my husband's a conventional doctor. He's changed since knowing me. And he's a combination, and he had his own issues that conventional medicine couldn't help. So he's very much into integrative, but not a certified integrative practitioner. But anyway, the point being is it's not that they don't mean well. It's just that they haven't really learned this piece of it. They've learned, it's just a little different training. So I'm always such a believer, and I hope they come to the summit. So it's not to shut them out. It's to educate so that they can incorporate more of this, and it becomes the norm.
Right. Yeah. The summit's designed to take you wherever you are and to enhance and to improve your current state. And I agree with you. The traditional medicine, the focus is to wait until you have a chronic condition and then try to fix the symptoms, not the root cause. And that's why I love so many of our lectures on the summit are focused on the prevention and the reversing and going after the root cause. So I'll also say if you want more information, I'll plug my own website, which is
Yeah,
just
yeah, yeah.
yeah,
That
yeah,
was my next question. How do people learn more about you and your
yeah,
work? Yeah.
yeah. It's just drjosh.com, drjosh.com.
It's amazing you got that title that you got that, there's so many Joshes in the world. My son's a Josh. It's interesting that you got
I I
drjosh.com. That
I thought about it early, so I got it.
Oh,
Yeah.
okay. I'm, like, impressed. Wow, usually you'd have to if you put that in, it would say, "Nope, nope, .com's gone." You would have to have dot something else. So that's great. And any last minute things before we end? This has been so helpful, and
And
thank you
no,
so
no,
much.
Margie, I really appreciate your time and being willing to be part of the summit. And I really enjoyed being on your podcast today.
Oh, well, thank you so much. It's been a pleasure, and I'm so excited for the summit. So thanks so much for joining today and just sharing all this great information.
Oh, my pleasure. Thank you.
I hope you enjoyed my interview with Dr. Josh as much as I did and learned some new things that you can put into your life that are going to nourish your brain, help prevent Alzheimer's. And the good news is there's so much that can be done to even reverse it. I am so excited about the upcoming summit on Alzheimer's that the link is in the show notes. And also, if it's past that time, then make sure just to go to drjosh.com for resources that can help you because no one wants to suffer unnecessarily. And as I said, there's so much good news on this topic. So thanks again for tuning in, and I look forward to seeing you on the next episode.